Health officials warned of a deadly phenomenon known as holiday heart attacks. A study published in the journal Circulation shows that more cardiac deaths occur in the U.S. on Christmas Day than any other day of the year. And the two other common days happen to be today and New Year's. Joining us this morning with some tips on relieving some of that holiday stress and protecting your heart is Dr. Sheryl Martin-Schild with the American Heart Association. Doc, good morning to you. What is it about today that causes heart attacks to happen?
You know, there's so much stress leading up to the holidays, the anticipation, the preparation, just trying to fit it all in, and for many people, financial stress. Then you get a lot of people together and they start drinking and eating poorly, and the words start flowing, and sometimes it leads to additional stress that could have been avoided.
Yeah, and obviously there would be a lot of factors involved in someone overeating or overindulging and triggering a heart attack, but if you have somebody with a heart condition has to watch overindulging?
Sure, taking smaller portions of those indulgent or salty foods, and then moderating that alcohol use. The words start flowing when you have a little bit too much alcohol, and you might pick the scab on some sensitive relationships, which can heighten the agitation and stress of an event like Christmas or Christmas Eve.
Just so people have a sense of the numbers, the British Medical Journal reviewed 16 years of data, found there was a 15% overall increase in heart attacks in general in the winter holidays. So I mean, it's not something you think about, but you want to protect your heart health.
It's a real phenomenon, and you can take a lot of steps to reduce the occurrence rate of having a heart attack or a stroke during the holidays.
Well, that kind of begs the question, what do we need to do?
Well, some of the most important things are to live prepared and not scared, know how to recognize the signs and symptoms, and then take action immediately. Dialing 911 gives you the best chance of surviving and reducing disability, particularly when it comes to heart attacks and strokes. And then if there's a cardiac arrest, initiating hands-only CPR right away can make a major difference, since most episodes of cardiac arrest actually occur in the home.
We hear of the kind of the Fred Sanford sort of, to date myself, the sort of stereotypical an elephant on your chest sort of feeling, but the symptoms don't always produce themselves in that way, do they?
No, they respond. They're different in different people, and especially women may have different types of symptoms. But any kind of exertional chest discomfort, shortness of breath, feeling dizzy, having pain radiate to the neck or to the arm, or just feeling sometimes indigestion or nausea or dizziness can be a sign. It's okay to overreact and get early attention and have a doctor tell you, oh, it was just indigestion. Oh, it was just this. But it's not okay to miss those early signs and symptoms that could save your life. And it's pretty depressing to have a heart attack or a stroke during the holidays or any time, but you can recognize and get the help that you need early and make a major difference.
And then those things we talk about so many times in these segments during the year: keep moving, eat right, all of those lifestyle changes.
Yes, exercising is a great way to reduce stress, and it helps you sleep. So then the next day you can handle situations a little bit better. Keep moving, take your medications, especially if you're traveling. Don't forget to pack your medications, especially blood pressure medicines and any type of antithrombotic.
All right, great advice as we often get from the American Heart Association. Dr. Sheryl Martin-Schild, thank you so much for your time this morning.
Thank you. Happy holidays.